Hey guys, I'm Heidi, and today we're going to do IV med push. We are going to do a IV fluids, and then we're going to do a piggyback. So first things first, before you get anything, you're going to want to check the patient's MAR, and you're going to check all the orders, make sure that they all are safe, and make sure that you have all the information you need to go into the med room to gather all your supplies. So once you check the patient's MAR and you get everything you need, and you head over to the med room, you're going to gather all your supplies. Usually in the med room they will have a computer system, so you want to get on that computer system and check again to make sure that you have all the right meds and all the right supplies for what the doctor has ordered for your patient. Once that we do all of that, we are going to gather our supplies, checking with the MAR and the medication that comes out of the med room. And you're going to take your supplies into the patient's room, and when you go into the patient's room, you're going to greet them, and you're going to also introduce yourself. Once you also enter the room, you're going to want to make sure to pull the curtain if they have one, or if they're in a room by themselves and they have a door, just make sure you shut the door behind them for privacy. So today what the doctor has ordered is some ondansetron, which is used to treat nausea and vomiting. And some of the side effects that you're going to want to look for that is going to be dizziness, headache, and some constipation. So when you're giving the medication to the patient, you're going to want to educate them on that, and then also have them inform you if they're feeling any of those kind of things once the medication has been given. The second thing they're going to get today is the sodium chloride. And so this is just going to be for hydration and electrolyte and balance, just to make sure that their electrolytes don't get all imbalanced and all weird. The patient does have a UTI, so they are also ordered some antibiotic, which this is ciprofloxacin. And so we're going to give this to the patient. This is the piggyback. The supplies that are going to come with that are the primary tubing for the sodium chloride, and you're going to have secondary tubing for the piggyback. And then you're going to want to have a saline flush. You're going to want to have a bunch of alcohol pads just in case you need them. And then you're going to need a syringe and your blood needle to draw the med. And these are some little alcohol infused caps for the port for the patient. And then you're going to also have your vial. So when you grab the vial, you're going to want to make sure, even all this other stuff, you're going to want to make sure everything is up to date and nothing's expired. And you're going to want to make sure that that when you grab this vial, it is the medication that you're supposed to have. A lot of meds have similar wording and names, and so you have to be very careful. So we have our Zofran, our ondansetron, and this piggyback medication. The things we're going to want to look for this is going to be just kind of headache, nausea and vomiting, dizziness, and then a photosensitivity. So just be aware of that, and you're going to want to educate your patient on those things as well. You're going to want to be careful for fluid retention for the sodium chloride, just so there's no fluid overload. Patients with congestive heart failure or edema or renal impairment are some things you're going to want to look out for. Also, you're also going to want to check to make sure that all of this stuff is in a safe dosage range, which everything is. We've done all the calculations for it, and so everything is safe. So once I enter the room, like I said, I'm going to introduce myself, and I'm going to have the patient tell me their first and last name and their date of birth. That I will be checking against the system and making sure that the person who is sitting here is also the person that I'm seeing in the computer. So I will verify that, and then I will also make sure that I verify the patient's allergies. And once you find out that the patient has or doesn't have any allergies, it's time to move forward. So today we're going to start with the IV push. So I'm just going to sanitize my hands. And then I'm going to don some clean gloves. All right. And then next I'm going to go ahead and just assess the patient's IV site. You just want to make sure everything's clean and intact. that the skin looks nice and healthy, that there's no redness or swelling, and any like puffiness, like tightness of the skin. It could just mean that there is infiltration or something's wrong with the catheter for the IV. So far everything looks great, so we are going to move forward and we're going to do our ondansetron. So the cap fell off because this has been used, but you're going to pop the cap and you are going to clean the top. You're going to want to clean this for 15 seconds and let it dry for 5. So while that's drying, we are going to open this up and put our blunt needle on. This is ready. All right, so here's our needle. So the order for the ondansetron calls for 4 milligrams of the medication. So if you want to look at our little cheat sheet here, it's going to be down there at the bottom. So it's going to be 4 milligrams ordered, and it is 2 milligrams per ml. And so we're going to draw up 2 mLs of the medication for it to be 4 milligrams. So you're going to fill the syringe with air, 2 mLs, and you are going to insert the blunt needle into the vial, air to air, and then you're going to want to flip it upside down, and you'll get that 2 mLs right back. Make sure there's no bubbles because you don't want to put bubbles in your patient's IV. That's not good. All right, so we have our 2 mLs. And you just don't want to stab yourself here. So here's our medication. And then you're going to grab your saline. Now these come with some air in them, so you're going to want to make sure you get the air out of them because you don't, like I said, no bubbles here, no bubbles here. So you are going to open this and just make sure there's no air. Okay, so I'm going to grab my medication, and I am going to grab an alcohol pad, and I'm also going to grab one of these ports for the patient. So we're going to cover it until we move on to the next step, which will be our fluids. So like I said, you've educated the patient on what to expect, and before we inject the IV medication, we are going to flush the line to check for patency. That's just making sure that the line is clear. There's no like kinks or anything in the line. And we are going to alcohol wipe this one. Just want to make sure everything's clean. You don't want to put anything dirty in there. All right. And again, for 15 seconds, let it dry for 5. So we're going to attach this to the patient's port. And you're just going to put half of this in. Checking for the, oh, we're going to unclamp it too. That's important. So unclamp it, and then you're going to go halfway. While you're doing this, you're going to want to assess the site as well. Make sure that there's no leakage and it's dry and intact, and that there's no swelling or edema or redness that's going on while you're pushing it in. Ask the patient if they feel any pain or anything like that. All right, so we're done with that. Now we're going to administer our medication.
Before we get started, we're going to use
Now this medication you need to administer over 2 minutes. It's not safe to just push it in there. So just over 2 minutes, you're going to slowly give the medication to the patient while you're giving it to them. Again, assessing the site, making sure there's no redness or swelling or edema, and that the patient's not feeling any pain or any weird effects of the medication. You'll want to make sure that they feel okay. For the sake of time, we're going to say it's been 2 minutes, so we're just going to, med is in, patient's feeling fine, and so we are going to flush the rest of this. All right, so we're going to flush this. Okay, perfect. All right, so we are going to clamp this and cap it. And these have alcohol in them, so it's sanitary and sterile. All right, now that we're done with that, we are going to do our IV fluid, our sodium chloride for our hydration and electrolyte balance. So first thing you're gonna do is you're gonna wanna hang the bag.
That was.
And again, you've already educated the patient just what to expect. So if they do start feeling anything, they could tell you.
This situation.
And then you have your primary tubing here. So you're gonna open this. And you're gonna make sure to keep all of this away from anything. You want everything as sterile as possible. You can take all the little papers off. And this. So you'll have your two ends here. This end is for the patient, and this is for your bag. So these bags come with a little cap, basically, and you have to puncture this for the fluid to come out, and that's what this is. So this needs to stay sterile, so you are going to clamp before you insert that, because then everything's going to go all over the place. So you want to clamp any of these clamps here. Make sure that nothing is going all over the floor or all over yourself or the patient. So everything's clamped, and we're going to take this off, and we are going to pull off this little cap, and we are going to insert it into the bag. And you're going to want to make sure that you go all the way in and straight in, because you can puncture the side of this bag, and then you will have fluids everywhere. Okay, so now that we have that in, I'm going to prime the chamber. You want to fill it like 3/4 full. This will prevent bubbling later. If you feel like you've done too much, you can always flip it, put some of it back, maybe a little more room. All right, so next we're going to prime the tubing. Basically, you just want to make sure that there's no air bubbles, because again, even with just the same as the med, you don't want any bubbles in the line. So we're going to take the cap off, and we are going to release our clamps.
We already put a green cap on it, so it's sterile, but if we didn't, we would.
And you can just do this over the trash. Just make sure you don't touch anything. And you're gonna release this clamp and just let it run through, and you can see the bubbles go.
So we're giving this at 125 mils an hour. The GTP range of this is 10 milliliters, so or 10 drops
All
a
right,
milliliter.
perfect.
So that's going to average about.
Okay, so this is all primed and ready to go. So we're going to put this on the patient, making sure to unclamp this. This has alcohol in it, so it's clean. So I'm just going to take that off. And we're going to attach this end here. And make sure you screw this part on, because this is what's going to lock it on and keep it on there. And then you're going to want to undo the clamp on this.
Last one we're going to do is
we are going to go back to our other clamp that we closed. And we are going to put this at 7 drops per 10 seconds. As you can see, our little cheat sheet here, that shows that that is the rate that we're going at. So you're just going to look at your watch for 10 seconds. And you just want to make sure that it is going at the rate.
We also assessed for allergies to begin with. So we did
Okay, great.
gloves on.
All right, perfect. So that is our rate for the IV fluids. So that looks good, everything's good to go. So our next thing is going to be our antibiotic. So with this antibiotic, again, we've explained to the patient what to expect, and we're going to want to make sure that, you know, they're going to tell us what's going on. Also, again, you're going to want to always look at the site. You want to make sure that there's no infiltration, everything looks good, clean, dry, and intact. Super important. Always check the site. So we're gonna do our IV piggyback, and this one is for ciprofloxacin, and this is an antibiotic. The patient has a UTI, so we are going to give them this, and it's going to attach to that fluid tubing. There is a port on there that this will attach to, and we will use this tubing to attach it. Again, our little cheat sheet here shows that we're going to be administering this 8 drops per 10 seconds. So we're going to pull out our IV tubing. Same thing with this. You want to make sure that the ends are not touching anything. Same idea with this one. Goes here. This one goes to the port. Move that. Again, you're going to clamp. This one has a couple clamps on it too. Just do both. Better safe than sorry. Alright, so clamp. And we're going to take this off. And we're going to take this off. And we are going to puncture our bag. Same thing with this one. You're going to want to make sure that you get it all the way in and not poke the sides and put a hole in it. So this is now going to hang here. And to get this to flow before this, we're gonna have to do a little trick. But first you wanna prime the tubing. So we're gonna prime the chamber just the way we did that one. Perfect. And then same as the last, you're gonna just go ahead and let some of it flow out into the trash. With this one, because it's a medication, you're gonna be careful and not just let it run. So just as soon as the bubbles are gone, just shut it off. Okay, so we are going to prime our tubing. Okay, bubbles are out. All right, so we're locked. I'm going to clamp this too. All right, so alcohol. We're going to clean the port here. This is our Y port. And you're going to rub this same 15 seconds, let it dry for 5. And you are going to attach this here. Same screw system, just make sure it's screwed on all the way. Okay, and then here's the trick. We are going to lower this bag because that will prevent the fluid from going into that bag and allow that to flow, and this will turn off. So now that we're all set here, we're going to unclamp our antibiotic, and we are going to check the flow rate on that, which I said again is 8 drops per 10 seconds. So you are going to set your drops at 8 per 10 seconds. Okay, perfect. So that is running, everything's good to go. Again, assess patient's site, make sure that they are not having any redness, any swelling, edema, any pain with this stuff. And again, have them let you know when they're feeling anything, any allergic reaction. Also, just make sure, always make sure for contraindications before you give any kind of medication, even if it's just sodium chloride. It's just very good to be safe. So now that we're all done with this, we are going to make sure that the bed is locked and lowered, and then we are going to make sure that the patient is comfortable, that they're feeling okay after all the meds that we've given them. And then we are going to give them a call light and ask them if they need anything. If they don't, we are going to just make sure they are okay, and then we are going to go and document all the things that we've done, fluid inflow and outflow, and all of the things that we've done, the medication we give, dosage, time, and everything. So remember your 5 rights, remember to assess the site, and just make sure that you check on your patient and make sure that they're safe after you give them medications. That's it.